Welcome all. Welcome to this AimExcellence question answer discussion. And in this particular question, we try to focus on the mechanism of injury of the fracture that we are focusing on. So Amir Khan went to weight training in order to get in proper shape for dangal. But after few reps of squats, he felt pain in knee. Afterwards, X-ray have shown fractured patella. Which of the following mode of the treatment is most likely to be implemented? Tension band wearing by stainless steel, B. Partial patellectomy, C. Total patellectomy, D. None of them. So first see this video a little. He's trying to do the squat with heavy weights, and after that he actually exhausted. So we are talking about patellar fracture patella. There are two mechanisms that causes fracture patella. One of them is due to the direct injury, direct force. That can be due to two causes, as due to the blunt trauma or somebody hitting your knee and patella got in between. In that case, direct injury. Or you are in the driver's seat or sitting beside, and your car is actually halting abruptly and you are hitting the dashboard. This is the direct injury. Another type of injury of patella is indirect type, which is due to the tremendous force of contraction of the muscle, mainly the quadriceps. And quadriceps is linking with the patella. So that particular tremendous force of contraction is actually causing generally transverse fracture of the patella, and it is causing displaced transverse fracture, mostly displaced transverse fracture of the patella. In the direct injury, we can have comminuted fracture or stellate fracture. Now this transverse fracture of the patella can be of two types. One is undisplaced, there is a fracture line but the entire patella is intact. This is the undisplaced. And another is displaced. And in explosive muscle contraction, like you are putting the squats without warming up, it can cause displaced patellar fracture in the most of the time. It causes displaced patellar fracture most of the time. So direct cases, comminuted fracture happens in the most of the cases, and comminuted fracture can also be two types, where at least the proximal third of the patella is intact. Rest of the thing actually broken down to the stellate fracture. And another is severely comminuted fracture. Total patella is broken into pieces. That can happen into the, if there is a force striking the patella, mechanical force, or it can also happen in the dashboard injury. So in cases of 1/3 of the patella at least is intact, we'll do in this case we are going to do the partial patellectomy. Here we are going to do the partial patellectomy. In this case we are going to do the total patellectomy. And in severe explosive muscle contraction, like giving squats with heavy weights, and if there is a displaced fracture, we are going to do the tension bend wearing by stainless steel. And in cases of undisplaced, if the extensor mechanism, when it is intact, we can give it the cylinder cast. We will give a cylinder tube cast in the full extension. We will give a cylinder tube cast in the full extension of the knee. So in this particular presentation, we have tried to talk about the mechanism of injury of the patella and what are the definitive therapies you will do in the different situation. As per as this question goes, the answer is tension band wearing by stainless steel, because there is the explosive quadriceps contraction and that is actually going to do displaced patellar fracture. This is going to do the displaced transverse patellar fracture in most of the cases. Hope you like this particular presentation, and little bit knowledge about the working out and the sports actually helps to understand the philosophy of medicine better. So it's not only cramming, that is the things I am interested in. It is sometimes racing of the heartbeat after doing some real serious workout, that also clears your thinking process. And hopefully this video is actually generated after working out, and I have a pretty stiff leg today, and hope you like this particular presentation. If you like this particular presentation and all our presentation, continue to be with us in the Facebook, Twitter and YouTube. In the upcoming days we are going to upload videos, particularly in 2019 for sure. And if you like our mode of presentation, please write to us. We are getting your messages and we are going to respond to the messages. Maybe it takes time. Right now maybe it takes around within 120 hours. We'll try to write back to you, and stay with us. We really value your support. Thank you.